Good afternoon and welcome to our show today. I'm your host, Barbara Walsh. On this segment, we have two community health nurses here to discuss the coronavirus protection and prevention. Our lines will be open for our audience at home and our viewers here today. If you have any questions, feel free to raise your hands. Our phone numbers will be listed below. Nurses, would you care to introduce yourselves?
Okay, thank you, Ms. Walsh. Hello, everybody. My name is Nurse Tessicum. I'm a community health nurse at the San Ignacio Community Hospital.
And my name is Kendra Betancourt. I'm also a nurse working at the San Ignacio Community Hospital.
Thank you, nurses. Can you please tell our audience what to expect from your presentation?
Define community health nursing and to be able to know more or less what the mission of a community health nurse is. We are going to be discussing the background of SARS-CoV-19. We are to define COVID-19. We're going to list the mode of transmission of COVID-19, the signs and symptoms of COVID-19, the risk factors that are associated with COVID-19. We are going to list protective and preventative measures to contain the spread of COVID-19 and to lastly list the statistics for beliefs to date of COVID-19. Okay, so to start off with community health nursing and what it is, it's just nursing care that takes place outside of the hospital setting, whereby we meet our goal by identifying the problems and supporting community participation in the process of preserving and improving the health of the community. The focus is on the health of the community itself rather than just the health of the individuals of the community. So we're trying to look at it on a larger perspective rather than just an individual perspective. And the mission of a community health nurse is to provide health promotion, health protection with health balance, disease prevention, and social justice. We obtain this by going to your house, which is what we call a home visit. We do teaching sessions. We also have a ton of pamphlets at the hospital that whenever you want to get something to read, if you want to be informed of something, then you can just go to the hospital and then you can pick up the pamphlets. So moving on to what the background is of SARS-CoV-19. COVID-19 is just the name of the novel coronavirus disease. SARS-CoV-2 is the name of the virus that causes COVID-19. Coronaviruses cause mild respiratory illnesses such as the common cold. We also have SARS, which is severe acute respiratory syndrome, Middle East respiratory syndrome, which is what we know as MERS. Now, COVID-19 is a new coronavirus disease, and this emerged from Hubei province in China, Wuhan, in December 2019. So what is COVID-19? COVID-19 is a disease that is caused by a new strain of coronaviruses. The CO stands for corona, the VI stands for virus, and the D for disease. Formerly, this disease was referred to as the 2019 novel coronavirus or 2019 nCoV. Moving on to the modes of transmission for COVID-19, we have a few, which is close contact. And when we speak about close contact, it is if you are within 6 feet of an infected person for more than 15 minutes. We also have direct contact. And this can be if you come in contact with bodily fluids such as the urine or feces of the infected person. We also have droplet, which occurs when the infected person sneezes or coughs. We have fomites. Fomites are just objects which host the infectious agents and serves as a mechanism of transport between hosts. And this can be whether the person, like I mentioned before, sneezes or coughs and the droplets, let's say, falls on a doorknob. Then you, who are not infected, goes and touches that doorknob, and then you proceed to, let's say, scratch your face or your eye, then you have a higher chance of being infected that way. And recent studies of the CDC have also shown that it can be airborne. So, the natural history of COVID-19. We start off with pathogen, which is a bacteria, virus, or other microorganism that can cause the disease. So, the pathogen for COVID-19 is what we know as COVID-19. It can also be other coronaviruses such as SARS or MERS-CoV. The reservoir is just a place where the germs can live and multiply. And for coronavirus, our reservoir is unknown. The portal of exit is the means by which the germs can escape from the reservoir. It can be by the infected person's airway, such as respiratory droplets, the mucous membranes, or even if the person sneezes. The transmission, this is just how the germs move or spread from one place to another. So it can be human to human transmission. It can also be by respiratory droplets, through our mucous membranes, or even close contact. Now, the portal of entry through which you can acquire the disease is through your airways, whereas you breathe in those air droplets that are exhaled by the infected person. The susceptible host now is any individual exposed to the virus, and this can be those who have compromised immune system, such as HIV/AIDS.
Right now we have a call from someone. Hello, can you please state your name and your question?
Hi, good evening. I was watching the show and I'm really interested in what you guys are doing right now, and I've learned a lot so far, but I wanted to ask a quick question. I just wanted to know what are some of the symptoms. Now, I'm calling from PG and I'm a little bit worried over here. So I just wanted to know if you could share some of the symptoms of COVID with me.
Hi, yeah, sure. Thank you for calling us. The symptoms are fever. The main ones are loss of smell and loss of taste. You can also experience dry cough, shortness of breath, or even in more severe cases, this can lead to an infection which can cause pneumonia. Some severe acute respiratory syndromes and kidney failure, which can even lead to death.
So when do you think should I be worried? Like, when do you think should I, go to the hospital to get a checkup?
Well, what we recommend is that you monitor your signs and symptoms, and if you have persistent cough, fever, and if you especially lose a sense of taste or smell, we have a hotline that you can call, and we have listed it below, so you can give the nurses there a call and they will take your information.
Oh, okay then. Thank you so much.
Thank you very much.
Okay, so we're moving on to the risk factors and severity of COVID-19, and this is with people who have the virus. They can have no symptoms or develop mild, severe, or fatal illnesses. Now, children may have less severe diseases, and this is with the exception of the child that had recently died. We don't know what the circumstances were to have led him to his demise. We don't know if he had any underlying condition or what was going on with his health. So other risk factors for you developing this severe illness may include if you're an adult 50 years or older, if you have underlying chronic medical conditions such as diabetes, hypertension, obesity, or even those with asthma. They can be pregnant women, especially those with compromised immune systems such as those with HIV/AIDS.
Now we are going to be moving on to the protection and prevention of COVID. And one easy way that our viewers and our audience here with us can remember the protection and prevention measure is just by simply to remember Wuhan. Wuhan, W-U-H-A-N. And as we stated before, Wuhan is the place where SARS-CoV-19 was first detected in 2019. So the H, what does the H stands for? The W, stands for wash your hands. The U stands for using your face mask properly. The H, have your temperature checked regularly. The A, avoid large crowd. And the N, never touch your face with unclean hands. Simple way to remember it. Wuhan. Wash your hands. So when you wash your hands, you normally wash your hands with soap and running water. And you only will do that if you feel like your hands are dirty or if your hands are visibly dirty. If your hands are not visibly dirty, you can frequently clean them with an alcohol-based sanitizer or a hand rub, or like I stated before, soap and water. Protect others from getting sick. How can you do that? When coughing and sneezing, cover your mouth and nose, and you can do this with an elbow flex or using a tissue. So I would just demonstrate quickly how you can do the elbow flex technique. And that is simply by, if you want to cough or sneeze, you go like this, and you will cough in between here, and whatever droplet or particle will not spread to whoever is beside you or 6 feet away from you. If you use a tissue, what you should do with that tissue, you would take that tissue and you would discard it in a container that is properly sealed, and you will not be opening and closing that container. When you're finished, you will clean your hand, like I said before, with an alcohol-based scrub, sanitizer, or soap, and of course you can wash your hands after you have sneezed. Practice good food safety is another preventative measure for COVID-19. And at home or in the restaurants, you can use different chopping boards and knives for raw meat and cooked food. Wash your hands between handling raw meat and cooked food. Even if the areas are experiencing outbreaks, meat products can be safely consumed there if the items are cooked thoroughly and properly handled during food preparation. Stay healthy while traveling. As we know, we have to travel. Most people here work out of district, and most patients have to seek medical attention away from home. So most people don't have the use of their personal vehicle, or they have to walk or use a public transportation system. So what we advise you to do is, while traveling, avoid traveling if you have a fever, cough, if you had been exposed to COVID before, or to anybody that has been experiencing some symptoms. You would want to try avoid traveling. If you have a fever, cough, and difficulty breathing, seek medical attention care early, and share previous health history with your healthcare providers. Avoid close contact with people suffering from a fever and a cough. Frequently clean hands by using the alcohol-based sanitizer, as I mentioned before, or soap and water. And of course, avoid touching your eyes, nose, and mouth. As we know, we're always using our face masks, so we would try to discourage people from touching it every minute. Stay healthy again while traveling. You will eat only cooked food. Avoid spitting in public places. Avoid close contact and travel with animals that are sick. If you become sick while traveling, inform your healthcare professional as early as possible. And if you need to seek medical attention, please share your travel history with the healthcare providers. Next, regular hand washing could be done for 25 to 30 seconds with soap and water. Cover mouth and nose when coughing and sneezing, and use tissue to cover mouth and nose should be disposed properly, as I said before. Eat thoroughly cooked food, meats, and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing, sneezing, and a fever. Seek medical advice or care immediately. And as I stated before, avoid unnecessary trouble. We have a question from one of our audience present here. Yes, sir, can you please state your question? Okay, so what the gentleman asked was if we had any recent statistics on COVID. We do actually. So the recent statistics for Belize up to date as of last night, there has been 22,658 tests that has been done, and there is 921 cases under investigation. Negative tests are 70,108. Confirmed cases so far, we have 3,462 positive cases. Of those, 1,576 are female and 1,886 are male, with 58 deaths to report, unfortunately. Another thing I want to state here is that the cases under investigation are cases that are persons that have been exposed to COVID or somebody that shows symptoms of COVID. They are not positive cases, but they are just individual that has been exposed at some point to somebody that had shown symptoms of COVID. How do you prevent the spread of the infection? And as I stated before, you have to wear a face mask in heavily crowded areas. When coughing or sneezing, use the bent elbow technique that I have shown earlier. And you can use a tissue as well to cover your mouth and your nose and dispose of it properly. Frequent hand washing with soap and water is always necessary. And avoid direct contact with eyes, nose, or mouth. And again, avoid direct contact with face mask. Avoid handshaking and hugging. Avoid close contact with sick people and their tools. So if you're at home, we would try to encourage you to do not be lending out your tools or equipment that you use at home during this time to anybody, because you do not know. There are patients that can be asymptomatic and can come and borrow your tools, and then you're not sick, and then the next thing you know, you start having symptoms of SARS-CoV. Avoid uncooked meat and eggs. Do not share your eating utensils, cup, or towel. I know this is a practice that we sometimes have. We would be eating our food and we have our friend close by. We're like, can I get some of your food? And we're like, sure, come. And we would tend to do that. During this time, we would try to discourage that practice. Remember, always practice safety first at all times. So I want to, you have anything you want to say, Miss, before we continue? Or
Yes, ma'am. I have two questions that I would like to ask her. The first question is, are there any statistics or any data informing the Belizean citizens if the coronavirus is affecting people of certain ethnicity or age more than others?
yes. So for Belize, unfortunately, we do not have any statistics on based on ethnicity per se. We only have statistics on the age group, which is whichever age group that developed COVID. Unfortunately, we do not have statistics on ethnicity, but as we can see the trend that it is affecting most mestizo individuals, and I would want to say Creole individuals, as well ages from 40 to 65, 70, and with the recent death of the baby that we had, that was a 6-year-old child. Also, we want to say that the COVID has been centrally located, I would say, in the Orange Walk district, where we have a most Hispanic population. That is, like, we would want to say, the center for the COVID outbreak in the country at this moment. That's where all the cases are coming from. And then also we want to highlight the Mennonite community, which is definitely in Blue Creek. We can say that there has been a lot of cases there recently, which is primarily due to the border crossing or border jumping that they would want to say at this moment. But for ethnicity, we do not have a particular race to say that it is affecting more this race to the other. And but like I stated before, the age group is between 40 to 70 and above, and with the exception of the baby that just died. I don't know if Miss Nurse Besicom would want to state anything else or.
Yeah, and if you can see the current statistics up to date, it's affecting mostly the males more than the females. So that's something that has to be looked on. That maybe they have they're more obese, they have more chronic underlying medical conditions, like I mentioned before. So we just need to eat healthy, keep washing our hands, keeping our distance, wearing our masks in public, trying to limit ourselves going out.
Thank you. My second question is, do you believe that we should have statistics on not just only on ages and ethnicity, but on other social demographics as well? You know, like by district or by urban or rural areas, who is being affected more?
Definitely, I think that that is part of the surveillance statistics that we would want to produce right now for release. But I assume that maybe down the road that would be something that the Ministry of Health will definitely have to put into place, because when you talk about statistics, we only get statistics on what people present with, and the statistics that we have are only statistics that people that have been exposed to, that we get the statistics from them. But I am sure that there are a lot more people out there that are infected that we do not know. So the statistics that we have is only what's readily available for us. But I am sure that that is definitely something to put into consideration. It would give you a better look at how this COVID pandemic is affecting our community, and what race and what age and where it is concentrated more. I think that is something that we should definitely look into, and it would provide the viewers, the audience, and everybody, the whole country, with a more precise information when it comes to COVID. So I think that is something that we should look into.
Thank you very much. We have one question from our audience. Would you like to answer the question?
Okay, so as it relates that if you think that you have any of these signs and symptoms, like I mentioned before, you need to keep close track of how persistent the fever is, or the cough that you have. And also, if you need to call it in, then we have a number that you can call, and the number is 0800 664 2273. This is just to report if you think that you have any of these symptoms that they are persistent, and if you think that you have been exposed to the coronavirus, then you can call that number and they will be able to help you more. Alright?
As well, I would like to just tell the lady that asked the question just now. I wanted to say that in every district we have what they call a flu clinic. So if you present yourself with any signs and symptoms, let's say you have a fever, a sore throat, you have a dry cough, you have lost your smell, your sense of smell and your sense of taste, you can come to whichever hospital nearest you, and we have a unit there specifically for individuals like this, and we have nurses there working around the clock, and nurses that are willing and able to provide services for you and provide the rapid test if you need it, or they will probably get the doctor to do the PCR testing for you, and then they will keep you there if your symptoms are severe, or if you can go home, they would ask you to go home, isolate yourself, and when the results are available, they will call you to get your results. And if you are a positive patient, then I assume that they will definitely ask you to quarantine yourself so that you do not infect other family members or anybody else. As well, if you feel like if you have been exposed to somebody suffering from the COVID, you would want to isolate yourself and seek medical attention as quick as possible.
Thank you very much, ladies. Do you have any final words for our audience?
Yes, well, I would just want to give a final recap of what we did today for our presentation for viewers here and our audience at home. So what we did, Nurse Gabriela Tesicum, she defined community health nursing and she stated the mission of the community health nurse. We also discussed the background of SARS-CoV-19. We defined SARS-CoV-19. We listed the mode of transmission. We listed signs and symptoms. We listed some risk factors, and we also listed protective and preventative measures to contain the spread of COVID-19, and we also listed the statistics for Belize as of the recent one up to date about SARS-CoV-19. I just wanted to say thank you very much for having us on our show. It was a pleasure and we had fun, and we hope that all the information that we have given to you all will be of use, and please continue to practice your safety measures. Make sure you wear your face mask, and always practice your etiquette, your cough and your sneezing etiquette. One more thing I wanted to say before we leave is that we just wanted to show you some of the, in front of us on our table here, we have some of the items you can use to help you protect yourself against SARS-CoV-19. Here we have baby wipes. You can have, they have all kinds of stuff now that you can buy, that you can use at home, you can use at work, you can use while traveling. So to keep yourself safe, you have baby wipes that you can take around. You can wipe the surfaces before you sit, before you touch. These are readily available at the store. You can purchase them. You can fill them with your alcohol at home. You can take them with you, and if you feel like you need to spray wherever you go, then you can use it. We have also the little hand rub sanitizer that I was telling you about. This, you can carry it with you in your purse, in your bags at all time. As well, the alcohol. You can use alcohol to wipe down your surfaces, anything. And we as well have the N95 face mask that provides you with 95% protection, and the regular face mask that you can use every day when you go out to the grocery store or to buy your vegetables, whatever. You can just make sure you have on your face mask. As well, if you are taking care of somebody that is suffering from COVID, you know that people, sometimes not everybody will want to protect themselves, so you have to protect yourself and anybody else that is with you. So you can use, these are disposable gowns. And why everything up here are disposable? Because we do not want to reuse anything, because by reusing something you can become contaminated. So whatever you use here is disposable. You use it, you throw it away, you make sure you cover that container properly, you seal it, you dispose of it properly. We also have some shoe cover here that you can use in case you have a patient that is having diarrhea or vomiting or anything, as we know that COVID can be transmitted through whichever type of body fluid. And the hat, that's a little hat that you can use to protect your hair. If you want extra protection, that's fine. You can use that little hat to cover your hair. When you're done, you can wash it with some Clorox and you can reuse it. As well, we have the face shield. Put it down here, Cecilia. You can use that little face shield that will give you extra protection for your eyes. And if you have on your face mask with that will definitely give you extra protection. Okay, so we just wanted to highlight all these stuff that we had here for our audience here that you can purchase anywhere, any store, and for viewers at home. Thank you so much for having us on our show. We had fun, and we just wanted to say that practice safety first. Always make sure you wear a face mask. Don't touch up your face mask too much. As well, I wanted to make sure that our viewers and our audience know that. I see we have a question from our audience. Can we please get that question?
Thank you very much, nurses, for the very valuable information shared today. I think it was very educational. I do have a question I wanted to ask after learning from you about the symptoms and so on, if I feel I have been exposed to a possible person with coronavirus, what is it that I should do?
Well, you should monitor these signs and symptoms, and like my colleague Nurse Betancourt stated, that if these symptoms are persistent, we ask that you call the Ministry of Health at 0800 664 2273, and they will be asking you a list of questions. Okay?
As well, what you can probably do, you can seek medical attention from your healthcare provider nearest you. Let's say you live in San Ignacio, you can probably go to the San Ignacio Community Hospital. They have a section only for patients with symptoms of COVID, such as sore throat, fever, cough and cold. If you have loss in smell, or you have lost your taste, you have a special department that deals with only patients like that. So I would tell you that if you have any symptoms, you can just seek medical attention to the nearest healthcare facility nearest you. All this information provided to you was from the Ministry of Health and Belize, the World Health Organization, the Pan American Health Organization, and the Center for Disease Control. Thank you very much.
Thank you, Ms. Walsh, for having us on your show today, and to our audience for extending us this time to educate them.
Thank you.
Thank you very much, nurses. We would definitely like to have you again to present to us. We would also like to give a gracious thank you to all our frontline workers, especially our doctors and nurses, who have been working diligently taking care of all of our Belizean citizens. And this concludes our segment today. Please stay tuned to watch our weather forecast. And on Monday, please join us as we have Dr. Summit Betancourt, who will be presenting to us a presentation on sustainable development and its impacts on the Belizean economy. Thank you very much and stay safe.
Thank you.
Thank you.
Bye.